I think sometimes pharmacists can be a little overlooked in terms of their triaging skills. I mean, they're having to deal with side effects a lot of things that are prescribed. So they form part of that primary care network, and they are health practitioners in their own right. I have a few friends and colleagues who are pharmacists and very well studied, and they're clinicians who are dealing with the public all the time. So certainly that first point of care for your minor red eyes, ocular discomfort, those sorts of things can be a first point of call, particularly with after hours. Obviously, more serious red eyes where it's involving a lot of pain and light sensitivity, then after hours you should probably heading to the local public hospital. During business hours, then typically in a metropolitan or large rural regional area like the Gold Coast, you could certainly find an optometrist fairly easily. But yeah, certainly for those minor early sort of irritations, there's this conjunctivitis, there's this allergy, the pharmacist play a great role. And like a lot of well-trained practitioners, they're aware of their own limitations. So if it becomes a point where they need to start to get into some differential diagnosis, that's when we can kind of step in.
Well, can you just explain what do you mean by differential diagnosis?
So, red eyes and itchy eyes, itchy eyes or gritty eyes, sometimes it can be hard to kind of pinpoint exactly that's coming from. Is it something that is a dry eye? If we look at conjunctivitis, is an inflammation of the conjunctiva, and the conjunctiva is the clear tissue that sits over the white part of the eye. So the white part's called the sclera, but we actually have a clear tissue over that is called the conjunctiva, and it's this loose tissue. And so we're familiar with getting conjunctivitis, and so that's the tissue that gets inflamed. And that can be caused by an allergy. So, same sort of triggers as hay fever, seasonal allergies, those sorts of things. It can be caused by viruses, and probably one of the more common ones is it can be caused by bacteria. And they all have subtly different signs that help you work out whether it's bacterial, viral, or allergic, so that you're using the right kind of product. And when you get into allergic conjunctivitis, then some of those symptoms might be sort of fairly similar to even dry eye. So being able to sort it out so that you're using the right kind of topical medication is important.
And although there are a lot of like non-prescription products that a pharmacist might be able to help you with, certain eye infections require a prescription medication, don't they? Like viral infections and that sort of thing.
Yeah. So if it's escalated to that, then that's when you may get into, for viral, that may need some sort of anti-inflammatory to help the person become comfortable with viral conjunctivitis. Typically, it's about comfort more than trying to actually manage the treatment. Sometimes it's just time's got to take its course, and it's being comfortable while you do so. The allergies are fairly well managed in most cases with your over-the-counter medications. It's a matter of getting the advice on the right ones, especially you've got to be careful about using them over the longer term. Or extreme cases, then you might be getting into something that needs to be prescribed.
And so, like, depending on where you are, like your environmental conditions might cause, more eye problems than others. Like I was talking to someone over in Western Australia a while ago in Port Hedland, and he was saying like the dust from all the mines and the wind coming in off the desert there, causes a lot of people to get conjunctivitis out where he is.
Yeah, and of course, if you've got foreign bodies, I mean, they can be carrying stuff that creates disease. You may well get a reaction to the actual whatever's on it. So again, it might be an allergic response, but yeah, look, it might be carrying bacteria and those sorts of things. I certainly know when, just personally, we've had renovations being done around a house, just the extra dust that happens, created some issues even in our own family. And if you're going into those sort of environments, that's where, talking to the pharmacist and talking to your optometrist about just some general lubrication as a starting point to kind of support what your tears are being stressed out doing, the place to start.